Okay, imagine a factory inside your body, a really powerful one. Now imagine that factory suddenly turning on itself, its own machinery starting to break down the very walls of the factory floor. Well, that's pretty much what happens in acute pancreatitis. It's a dramatic internal crisis. So we're going to follow the entire journey, right from that initial explosive attack all the way to the road to recovery. So let's just start with a kind of wild question. What organ in your body can literally start to digest itself? Yep, the answer is the pancreas. And when it turns on itself like this, it is not just a problem. It is a full-blown medical emergency.
And look, this is not some rare, obscure condition we're talking about. We're talking about nearly 300,000 hospital admissions in the U.S. every single year. It's a huge public health challenge. And, the really worrying part? The numbers just keep climbing.
So what exactly is this thing? Well, acute pancreatitis is this sudden, incredibly painful inflammation. See, normally, your pancreas makes these super powerful enzymes to digest food down in your intestine. But in this case, those enzymes get activated way too early, inside the pancreas itself, and they just start attacking the organ. It's a case of friendly fire, and it is devastating.
All right, so that brings us to the first stage of our journey, the attack itself. Picture this. A patient shows up in the emergency room, just doubled over in agony. How do doctors figure out for sure that it's acute pancreatitis?
Well, they use this brilliantly simple little trick called the 2 out of 3 rule. It's super effective. First, does the patient have that classic severe upper belly pain, the kind that feels like it's boring a hole straight through to their back? Second, you check the blood. Are key pancreatic enzymes like lipase at least 3 times higher than normal? And third, you look at a scan, maybe a CT. Do you see inflammation? You just need 2 of those 3, and boom, you've got your diagnosis.
So what's actually causing this internal firestorm? Well, the list of culprits is surprisingly short. Gallstones, believe it or not, are the #1 cause. They're responsible for up to 70% of cases. And right behind them is heavy alcohol use. So yeah, between those two, you've got the vast majority of all attacks covered. Okay, so once that diagnosis is made, the clock starts ticking loudly. These next few hours are absolutely critical. I mean, the decisions made right here can literally be the difference between a patient going home in a few days and a life-threatening ordeal. Now, to get why the treatment is what it is, you have to understand the central crisis going on inside the body. The inflammation is so intense, it makes the blood vessels super leaky. Just massive amounts of fluid pour out of the bloodstream and into the abdomen. They call it third spacing. This whole process makes blood pressure tank, and it starts starving the pancreas and other organs of the blood and oxygen they desperately need to survive. This diagram here really shows that battle playing out. So on the left, you see a normal pancreas. In the middle, it gets all swollen and puffy. That's edematous, as all that fluid leaks out. And then on the right, that's the worst case scenario. It's called necrotizing pancreatitis, where parts of the organ literally start to die from that lack of blood flow. The #1 weapon we have to stop this whole cascade? Aggressive IV fluids. You've got to refill the tank and get blood flowing back to that pancreas, fast. But, and this is a really crucial, game-changing insight, it turns out not all fluids are created equal. For years and years, normal saline was the standard, the go-to. But we now know it's a little bit acidic, and it can actually add fuel to the fire of inflammation. The clear winner based on the evidence is lactated ringers. It's a more pH-balanced solution, and studies actually show it helps calm the body's over-the-top inflammatory response. It's a huge deal.
So after those first critical hours of hydration, the patient comes to a fork in the road. And from here, their journey can go in 2 very different directions. It all depends on how their body responds to that initial attack.
Thankfully, the vast majority of people, we're talking about 80%, have what's considered a mild case. It's awful for sure, but it resolves in a few days. But for that other 1/5, that remaining 20%, the inflammation doesn't quit. The disease gets worse, and it can lead to some really severe, sometimes deadly, complications.
The one complication that doctors fear the most is called pancreatic necrosis. This is when parts of the pancreas literally die off because of that lack of blood flow we were just talking about. And this dead tissue isn't just useless, it's also the perfect breeding ground for bacteria, and that can lead to a massive systemic infection. It's a very dangerous situation.
So how do you manage something this serious? Well, this flowchart shows the modern approach, which is actually more patient than you might think. The big decision point is whether the patient is stable or unstable. If they're unstable, of course, they might need emergency surgery. But, and here's the big change, if they're stable, the new thinking is to wait. Doctors use powerful antibiotics and actually delay any kind of procedure for 4 to 6 weeks. This amazing patience lets the body build a natural wall around all that dead tissue, which makes it much, much safer to eventually go in and clean it out.
All right, now we get to the final part of the journey, the road to recovery. And honestly, this is where some of the most dramatic and frankly counterintuitive shifts in medical thinking have happened. It all revolves around one simple question. What should the patient eat?
For decades, the logic seemed pretty simple, right? If the pancreas is on fire, the last thing you want to do is throw fuel on it. The whole idea was to rest the pancreas, and that meant patients were strictly forbidden from eating or drinking anything, sometimes for weeks on end.
Well, it turns out that entire idea was completely wrong. We have seen a total 180, a complete paradigm shift, from gut resting to gut rousing. We now know that starving the gut actually makes everything worse. It weakens the walls of your intestines, and that allows dangerous bacteria to leak out and infect the already damaged pancreas. So what's the new approach? Feed the patient, and feed them early. It keeps that gut barrier strong and actually helps prevent those deadly infections.
And the surprises just keep coming. That old, super cautious way of reintroducing food, ice chips, then clear liquids, then soft foods, and on, that's out the window too. New guidelines actually show that for mild cases, it's perfectly safe to jump straight to a low-fat, solid meal as soon as the patient says they're hungry. Pretty amazing, right?
Of course, a true recovery isn't just about walking out of the hospital. It's about making sure this never, ever happens again. And that means you have to go after the root cause aggressively. If gallstones were the trigger, that gallbladder should come out before the patient even goes home. If you don't, the risk of it happening again is just incredibly high.
So, let's put it all together. The modern playbook for pancreatitis is all about being smart and proactive. Job number 1 is immediate, targeted hydration using the right fluid, lactated ringers. It means thinking gut rousing, not gut resting, so feed the patient early. And in those really severe cases, it means remembering that patience is a virtue, waiting for the right moment to intervene.
Which kind of leaves us with one final thought. Remember the 2 main causes, gallstones and alcohol? Both are often tied to our diet and lifestyle. So given that this incredibly painful, serious, and expensive condition is so often preventable, what does the fact that it's on the rise say about our broader, collective health? It's definitely something to think about.